Good afternoon and welcome to the House Government and Health and Government Operations Committee. We are one day past the day when the bills were crossing over between the House and the Senate to the opposite chamber. So our procedures for hearings are a little bit different. These are sponsor-only hearings, and the sponsors will be given 5 minutes, and then the committee will have the opportunity to ask questions. There are a number of bills that may have identical cross files that have already passed the House, in which case we just need to know that in order to move forward. So with that, we will ask your patience if we have any technical difficulties, but we will begin today's hearings with Senate Bill 159. This is Senator Kelly. Senator Kelly, welcome to HGO this afternoon. And this is Health Occupations, Authorized Prescribers, Financial Reporting. Senator Kelly.
Thank you very much, Madam Vice Chair and members. I want to start by saying that what was a very simple bill intended to have health occupations, the practitioners who accumulate gratuities within any given work year of $5,000 or more to report that to their occupational boards, and the boards can see patterns, can investigate to see if anything needs to be audited. In some cases, it's a really simple bill. You have testimony from the Attorney General's office, the Health Education Advocacy Unit, supporting the bill. But what happened here in the Senate was kind of untoward. It was in EHE, Education, Health, and Environment. And the physicians didn't want to have to be in the bill. And the chair of EHE tried to accommodate them. In fact, I'm seeing he had a new fiscal note drawn, which turns this into an expensive bill to be implemented. And it also would have the physicians needing to use something that they use already, but they don't do anything with it in Maryland. That's the website, let me see what the darn thing is called. The Open Payments website, which is a national website, is so massive, I've looked at it, that there was nothing in this bill requiring the use of it. But they have a third reader fiscal note I'm seeing that would require them to do that. So when physicians saw that, they asked to be taken out, and EHE accommodated. Today, I get emails and papers from the dentists, the nurses, the healthcare practitioners, and several other boards, all wanting to come out because they think that it is a huge bill and a whole lot of something they've got to do. If any of them aren't accepting gratuities that in any one calendar year amount to $5,000 or more, they don't have to do anything. If they did accept, there could be a reason. Our concern was that healthcare costs are driven up significantly by manufacturers who give gratuities to get doctors and other providers to push their devices or to push their prescriptions. And we wanted to see, to have the occupation boards in Maryland be able to see where that appeared to be regular practice going on and to look at the situations. The bill does not tell them really what to do about it. So I would ask you to take a good look at the testimony from the Office of the Attorney General. And I was going to ask, and I still will, if you're inclined, to put the doctors back in it and turn the bill back to what it was. It is not what the Physicians Board has been led to believe they have to do, which would be to go to the Open Payments website. There's nothing in this bill asking them to do that. That was something that was a fictitious that grew somewhere in EE and would create a huge financial burden on their board because that's a website that's national. And just to go into it at all, to see who has done anything, if you did it that way, which is not what the bill requires. It asks the practitioner to tell you if they have accumulated more than 5,000 or more in a year, would be a really unwieldy thing. So I'm going to ask you if you wouldn't mind to work with us and to put the docs back in, turn the bill back to what it was, which was just a reporting on the part of the practitioners if they, to their occupational board, if they accumulated in 1 year 5,000 or more of gratuities from medical device manufacturers and/or from prescription developers. Thanks so much for your attention. I know you care, and we all have poor people who can't pay their bills. Medicaid is even having to pay too much. It's not fair to have prescribing practices that are forcing people to pay more so that the entities that you are dealing with to get your gratuity are getting their devices or their prescriptions used in great numbers. Thank you so much.
Thank you very much, Senator. Does the committee have any questions of Senator Kelly? I have Delegate Johnson.
Yes.
Thank you, Madam Chairman, and thank you, Senator, for bringing this bill. Senator, isn't this exactly the practices that got the opioid out of control, the opioid prescriptions out of control in this country? Manufacturers offering vacations, bonuses to prescribers, and is that what this bill is trying to keep an eye on?
That's the point.
Thank you very much. Thank you, Madam.
Things that are unnecessary just to drive up costs because somebody is getting a gratuity.
Thank you, Senator. Thank you, Madam Chairman.
Thank you, Delegate. Delegate Morgan.
Thank you, Madam Chair. Is this the exact cross-file of the House bill that we passed?
We have not passed it
as a cross-file, but he took the physicians out and had a new fiscal note drawn, and the fiscal note is a total fiction. It has stuff in here that is not in the bill at all. So the third read of fiscal note, go back to the original fiscal note, which was in your version of the bill, the way the bills came in, and it's nice and simple and easily accommodated.
Okay, I appreciate it. Thank you, Madam Chair.
Thank you.
Thank you, Delegate. Are there any further questions? It is my understanding that this bill may be in subcommittee. Delegate Kelly?
Yes, we have it in subcommittee this week.
Yes, okay. So we'll be talking about it on Thursday, Senator.
Thank you so much.
Okay, seeing no further questions, that ends the hearing on Senate Bill 159. Thank you, Senator Kelly. And we will move to Senate Bill 446, which is Senator Wallstreicher, Public Safety, Fire, Rescue, or Emergency Medical Services Entities, Peer Support Programs. This is a cross-file of House Bill 581, which did pass the House, and the vote was unanimous. So, Senator Wallstreicher, welcome. You have up to 5 minutes, but things are looking good.
Yes, I will take 20 seconds. As you mentioned, Madam Subcommittee Chair, this bill is an exact cross-file of House Bill 581, which has already passed your committee and the full House unanimously. Both bills are exactly in the same posture. Both bills were amended, and those amendments are exactly the same. I ask for a favorable report.
Thank you very much, Senator. Are there any questions of the subcommittee on this bill? Seeing none, that concludes the hearing on Senate Bill 446. We will go to Senate Bill 317. This is Senators West and Wallstreicher. This is State Government Notarial Acts, Fees and Use Communication Technologies. This is a cross-file of House Bill 663, which passed the House unanimously. Welcome, Senator West.
Thank you very much, Delegate Cullison. And it's so good to see so many good friends on HGO. I really miss it. I gotta tell you, I really miss it, but time moves on. So just as Senator Wallstreicher said with respect to the last bill, this bill, Senate Bill 317, is, I believe, in exactly the same posture as House Bill 663, which passed the House unanimously 129 to nothing, also passed this committee 23 to nothing. I checked, my bill has no amendments. It was not amended. I haven't had the opportunity to page by page go over the two bills, but if you did not amend House Bill 663, then these two bills are identical.
Okay. Are there any questions for Senator West? Seeing none, we have a wave from our chair. And thank you very much, Senator. That concludes the hearing on Senate Bill 317.
Thank you so much. Take care.
Thank you. This will go to Senate Bill 365. This is Senator Simonaire, State Government, Maryland Veterans Commission membership. It is a cross-file of House Bill 237, which is awaiting action. So Senator Simonaire, welcome to HGO.
Good afternoon. My name is Carly.
Hi, Carly.
I'm representing Senator Simonaire to present Senate Bill 365, which would add a member of the Reserve Organization of America to the Maryland Veterans Commission. It is identical to House Bill 237, which you passed earlier this session. We request a favorable vote on this bill. Thank you.
Thank you very much. Any questions for the Senator's designee, Carly? Seeing none. Thank you very much for presenting today. And we will move to Senate Bill 37, Senator Augustine, Health Occupation State Board of Massage Therapy Examiners, requiring license to practice and other revisions. This is a cross-file of House Bill 2020, which has passed unanimously. So Senator Augustine.
Thank you, Chair Collison. Senator Augustine for Senate Bill 37. It is very similar. The only change is that Education, Health, and the Environment changed the civil fine from $50,000 down to $10,000 because they thought that was a high fine. The Maryland Department of Health and the board have said that they are fine with that. And so I just share with you that, this was cross-filed by Subcommittee Chair Kelly and worked on by her, quite honestly. And so I just would ask for you all to take that into consideration as you consider the bill.
Thank you very much, Senator. Delegate Kelly, you have a question and more information for us, perhaps?
Yeah, it was more of a comment than a question. Senator Augustine, I understand you guys lowered the penalties. I think we're going to be discussing that in subcommittee on Thursday, but I imagine we'll be comfortable with that. So just wanted to give you a heads up that we'll be discussing it this week.
Thank you, Subcommittee Chair Kelly.
Are there any questions for Senator Augustine? Okay. Thank you very much, Senator, for coming today. And
thank you.
I understand that Senator Eckert is going to be late. We are waiting on senators right now. So if we can hold for just a moment.
Does anyone see a bill that they have the cross file to that we could just run through them? Are any of these bills your bills on our side?
I'm asking the committee members, do you have any of your cross files? State Board of Dental Examiners, whose was that?
I have the dental board bill. I just saw that.
Okay.
So
Delegate Bagnall has the Interstate Medical Licensure Compact.
Okay, so Senator Delegate Kelly, would you like to speak?
SB 386 is the Senate bill. We just took this up in HGO last week and it passed unanimously. We conformed to the Senate amendments. And that bill is going to update the timelines for dental board discipline and require more training for the dental board.
Okay. The State Board of Dental Examiners. And that was anyone who had House Bill 969.
Oh, I'm sorry. I did
Yeah.
the compact instead of 969. I'm sorry, my bad. I did 969. Now Bagnell has the compact.
Oh, okay. And so Delegate Bagnell, do you want to speak to 386?
Again, it's the Delegate Kelly is correct. It is the sunset extension for the licensure. I believe it passed the House unanimously, and I'm just making sure that I'm correct, but I believe that the Senate conforms to the House bill.
All right. So I think Senate Bill 626 crossfile was House Bill 1464. I think that was Delegate Sample Hughes. Is Delegate Sample Hughes here? Not seeing her. Senate Finance and Procurement, that's Senate Bill 461, House Bill 723. Did 723 come from a member of the committee?
No, that was Delegate Charles.
Okay, thank you, Lindsay.
If you need to do 626, I probably can, because we did just pass that out of subcommittee for Delegate Sample Hughes as well.
Oh, okay.
So Senate Bill 626 is the loan assistance repayment program for physicians and physician assistants. It modified it to allow for part-time physicians to participate and established the permanent commission or something to that effect. And it passed unanimously.
Okay. So Senator Lamb is now here for Senate Bill 306, dental hygienists, consultation requirements, healthcare practitioners. Senator Lamb, this was a crossfire with House Bill 219, which passed the House unanimously. Would you like to speak to the bill? Welcome, Senator Lamb.
Sure, thank you. Happy to be here. Good afternoon, Chair, Vice Chair, members of the committee. Thank you for the opportunity to testify before you. This is a crossfile of HB 219 for the record, Clarence Lamb, Senator District 12. So to remind the committee, this bill seeks to build on legislation that the General Assembly passed unanimously in 2019, which allowed dental hygienists to provide services in nursing homes, assisted living programs, group homes, adult daycares, and physician offices. In addition to these doctors' offices, this bill also adds offices of nurse practitioners, certified nurse midwives, and licensed certified midwives. And although there are a variety of ways that this bill could help improve access to dental care, we believe that it'd be particularly impactful during pregnancy. The American College of Obstetricians and Gynecologists estimates that 40% of women experience some form of periodontal disease during their pregnancy. And ACOG also found that 56% of women do not see a dentist while they're pregnant. So I believe that this bill is an important addition to the state's decision 2 years ago to expand Medicaid to include postpartum dental care, and the discussion this year to add adult dental coverage to Medicaid, which is incredibly important. Dental hygienists will be required to be supervised by a dentist. Services provided would still be limited to basic preventive work, such as dental hygiene instruction and the application of fluoride, unless other services are ordered by a dentist. The supervising dentist would also be required to examine the patient following an initial appointment and at least once every year afterwards. By requiring the involvement of a supervising dentist, the bill will also serve as an avenue to connect more patients with a permanent dental home. So I appreciate your attention on this bill and urge the committee to have a favorable report on SB 306. Thank you.
Thank you, Senator. Are there any questions from the committee? Okay. Seeing none, then that concludes the hearing on Senate Bill 306. I understand that Senator Beidle is in the House, and welcome, Senator Beidle. We've heard a little bit about Senate Bill 611 and 386. They both passed the House unanimously. Would you like to add anything, any more information about either one of them?
Thank you, Madam Chair, Madam Delegate, and to all the members of Health and Government Operations, and thank you for hearing the bill. I would only say that this bill is in the same posture as the House bill, and I'm happy to share more information if anyone has questions, but you know, they're both in the same posture, and hopefully we're both successful.
Thank you, Senator. Are there any questions for the Senator on 611 or 386? Seeing none, thank you, Senator, for your time. We will go, so I see Senator Griffin here. So Senator Griffin we'll go to Senate Bill 461. Senator Griffin, State Finance and Procurement, Procedures and Pricing and Selection Committee for Preferred Providers. And this is a cross-file with House Bill 723, which passed the House unanimously. Senator Griffin, would you like to add any more information?
No, thank you, Madam Chair and committee. It's a pleasure to be here. The only thing I would say is I believe you all adopted some amendments to House Bill 723. I haven't had an opportunity to go through them yet. Senate Bill 461 passed the Senate in a slightly different posture. So hopefully we can have a conversation and I can learn about the changes that you all made, but I'd certainly ask your favorable report.
Okay. Senator, you also have the Maryland Loan Assistance Repayment Program. I know we heard a little bit about that from Delegate Kelly. You want to add any more information about that bill?
Senate Bill 626. Thank you, Madam Chair. Cross-file to House Bill 1464, which you all passed unanimously. So rather than take anything away from that, I'll stop and say, hope you can do the same for our bill. Thank you very much for your time.
Thank you, Senator, very much for your time for coming today. So that concludes the hearings on Senate Bill 626 and 461. And let me see if we have any more. Senator Eckert is the only senator that we do not have. And Senator Kagan will, is there, Lindsay, who was the cross-file on Senator Kagan's bill, House Bill 375?
That was Delegate Corman.
Corman, okay. Delegate Rosenberg, would you like to speak to Senate Bill 269 as it relates to House Bill 375?
Delegate Rosenberg is not in the call.
He's
No,
not on the
he's
call.
excused today. I believe that passed.
It
I
did.
do not recall if there were amendments, but we'll make sure we put it in the same posture as the bill that did pass the committee.
Okay.
Okay.
Okay, and so we will go to Senator Eckert is not here, but we can have a discussion of Senate Bill 513. It is the cross-file of House Bill 276, of which I am the sponsor. That's Health Occupations Clinical Nurse Specialist Prescribing Authority. My understanding is that we are still working through this bill and that we will be looking to discuss it a little bit further. Delegate Kelly, do you have any more information about that, given your subcommittee?
No, I think that's an accurate assessment. We've discussed it already in health occupations, and it's on our list to continue discussing. There's some concern from some of the stakeholders still, but a will to figure it out.
Okay, thank you very much, Delegate Kelly. Senator Kate.
Yeah.
I'm sorry. Senator Kagan, thank you for coming. Senate Bill 269 is the cross-file of House Bill 375, which passed the House unanimously. Open Meetings Act Application and Enhanced Requirements, Maryland State Agency Transparency Act of 2022. Did you want to add any more information, Senator Kagan?
Thank you so much, Delegate Collison. Welcome, colleagues. I'm delighted to be here. I'm sorry, I was chairing EHE in the chair's absence and stuff. Cheryl Kagan, proud to be the senator for Gaithersburg and Rockville. Each year, the last several years, I've worked with wonderful Delegate Corman on increasing transparency, especially in a post-COVID year. We want to make sure that Marylanders the press and others can continue to monitor what's going on in Maryland state government. So each year we've expanded the number of agencies and departments that are covered. We ask for 48 hours in advance, making sure that the agenda and materials are posted online, easily accessible, live stream the meeting, and then post minutes within 2 business days after the minutes are approved. It's pretty simple, and especially in a Zoom era, people are having no problems with it. This year's bill, we did acquiesce to exempting field trips, site visits and stuff. If no business is done, we don't think they should have to schlep video cameras or worry about Wi-Fi access. We have added a few more agencies, including TEDCO, the Technology Development Corporation, St. Mary's Historic District Commission, which apparently has needed some extra sunshine, in addition to the others that we started off with. I am happy to take questions, but I'll be brief. So thank you for your consideration. It passed both the committee and the Senate unanimously, and you referenced the unanimous vote in the House as well.
Thank you very much, Senator. Are there any questions of the committee? Seeing none, that concludes the hearing on Senate Bill 269. Thank you, Senator, for your time.
Great to see you guys. Take care. Bye-bye.
And I know that Senator Eckert is not here. Susanna, can you tell me, are they anticipating coming, or can we relieve them of that responsibility?
I just got an email that they should be making their way right now.
Okay. And we'll give her a minute or so. Okay. All right. Okay. In the interest of time and the fact that we are on Zoom and not holding everyone up, I think let's communicate with Senator Eckert that we are continuing to work on the bill. We have a cross file over here in the House, and just tell her that we'll be in touch with her on this. And with that concludes the work before us today. We will be back on the House floor tomorrow morning at 10 o'clock. Thank you all and have a great afternoon.